guys go. All right, this gentleman in the suit.
Welcome to me, Mr. President. It's an honor to have you here.
Thank you, sir.
My name is John Corpus. I'm fortunate enough to be here with my 10-year-old daughter who is missing her last day of school for this. I hope she doesn't.
Oh, no. Do you need me to write a note?
I'll take that one.
Go ahead. I'll start writing it now. What's your name?
John Corpus.
No, her.
Oh. Well, considering I have some people here from work that are very interested in...
No, I'm serious. What's your daughter's name?
Her name?
Huh?
Her name is Kennedy.
Kennedy, all right. That's a cool name. All right, to Kennedy's teacher. Okay, go ahead. I'm listening to your question.
Thank you, sir. I work in the health system, and we work with employers, we work with payers, brokers, everybody to try to lower costs for employers. We have retail health clinics, walk-in clinics, regular primary clinics, an emergency department, and everybody's trying to do something now. But all I'm hearing is about what's going to happen long term. And my question is, what is a timeline that we have set up for this? What do you see happening, especially in the area of working with employers to either offer more insurance or the uninsured, being able to get them something now?
Well, look, we're not going to be, whatever reforms we set up, it will probably take a couple of years to get it in place. There you go. Whatever reforms we pass, it's going to take a couple of years to get all the reforms and all the systems in place. There are some things that I think we should be able to do fairly quickly. For example, the pre-existing condition issue. Some of the insurance reform issues, I think we should be able to get in place more rapidly. The thing that I think we're going to have to spend the most time thinking about and really get right, and you probably know more about this than I do because you're working with a lot of these employers, insurers, and so forth, is how do we change the medical delivery systems that can either drive costs way up and decrease quality or drive costs down and improve quality. Let me describe to you what's happening. Part of the reason that Green Bay is doing a better job than some other parts of the country. There are places where doctors typically work together as teams. And they start off asking themselves, how can we provide the best possible care for this patient? And because they're coordinating, they don't order a bunch of duplicative tests. And the primary care physician who initially sees the patient is in contact with all the specialists so that in one meeting they can consult with each other and make a series of decisions. And then they don't overprescribe. And they make decisions about how quickly you can get somebody out of a hospital, because oftentimes being in a hospital actually increases the incidence of infection, for example. So there are a whole series of decisions that can be made that improve quality, increase coordination, but actually lower costs. Now the problem is more and more what our healthcare system is doing is it's incentivizing each doctor individually to say, how many tests can I perform? Because the more tests I perform, the more I get paid. And it may not even be a conscious decision on the part of the doctor, it's just that the medical system starts getting into bad habits. And it's driven from a business mentality instead of a mentality of how do we make patients better. And so what you've got is, a situation where, for example, the Mayo Clinic in Rochester, Minnesota is famous for some of the best quality and some of the lowest cost. People are healthier coming out of there. They do great. And then you've got places, there's a town in McAllen, Texas, where costs are actually a third higher than they are at Mayo, but the outcomes are worse. So the key for us is to figure out how do we take all the good ideas in a Mayo clinic and spread them all across the country so that that becomes the dominant culture for providing health care. That's going to take some time. It involves changing how we reimburse doctors. It involves doctors forming teams and working in a more cooperative way. And that's kind of a slow, laborious process. So here's the bottom line. If we pass healthcare reform this year, my expectation would be that immediately families are going to see some relief on some issues, but we will not have the whole system perfectly set up probably until, say, 4 or 5 years from now. And I think that's a realistic time frame. But if we wait, if we say, well, you know, since we're not going to get it right away, let's put this off until 2 or 4 or 5 years from now, it's never going to happen. That's what's been going on for the last 50 years now. People have said, we can't do it right now. And as a consequence, it never gets done. Now's the time to do it. All right?